everyone. My name is Megan Donnelly. I'm the registered dietitian at Schär. We're so excited to be partnering on this event tonight with Beyond Celiac, Boston Children's Hospital, and the University of Chicago Celiac Center. We have some amazing content for you tonight and a lot of collaborative exercise, we hope. So in addition to that, we have our student ambassadors from the Beyond Celiac program. So just a few things before we get into the speakers and while we get started. While the speakers are presenting, if everyone could go on mute, that would be great. And we will definitely have a chance for everyone to collaborate. So you will get your chance to chat, but for now we'll go on mute. This program is being recorded and we'll post it after the event, and I'll make sure all of you have a link to it after the event so you can share it with your friends, anyone else who might be struggling with the college experience, and we want to spread the word and hopefully get some really good stuff and recommendations after this. And just also throughout the presentation, if you want to put your questions in the Q&A box, that will really help us. You know, we're going to open it up to questions for the speakers at the end of the presentation. So just put all of your questions there. If you want to chat, you can add your, if you want to comment on something, feel free to put it in the chat. I'd actually, as an opening activity, love to hear where you all are from. If you want to type your college and where you're calling in from in the chat, that would be awesome. A nice way to kind of figure out where everyone is. And I assume we're all over the country based on the registrations I saw. So that's great. And we will, like I said, have an opportunity for breakout rooms later on in the presentation. So you will get a chance to collaborate with others. All right, so with that, I'm just going to briefly introduce the speakers before we get into the content. So we have Valerie Kraft from Beyond Celiac. She's the Community Engagement Manager at Beyond Celiac and manages the Student Ambassador Program at Beyond Celiac, which we're going to talk a lot about later on in the program. It's an awesome program, and we're hoping to get more members. We have Vanessa Weisbrod, who is the Director of Education and Community Engagement at Boston Children's Hospital Celiac Centers, and she is actually on the Celiac Cruise Alaska right now with a room full of college-age students, so that's exciting. And you guys should all check out the Celiac Cruise website when you can, because they have some amazing cruises coming up. And then we have Dr. Ritu Verma, who is the Chief Gastroenterologist at University of Chicago Medical Center Celiac Disease Center. So we are very grateful to everyone for being here tonight. Now I'm going to share our presentation with you all, if you give me 1 second. All right, let me just see. All right. Give me a second. It's not showing up for some reason. Here we go. All right. So with this, I'm going to ask if the student ambassadors would introduce themselves. So we have Alyssa, Olivia, Julia, and Noah with us tonight, and I'm going to let them introduce themselves.
Just a second. Sure, I could start it off. Hey everyone, my name is Noah Lusfader, and I'm going to be a junior at Vanderbilt studying health economics and also business. And I've been with Beyond Celiac actually for the past year, and it has been a really great experience. I recommend everyone joining and becoming college ambassadors as well. It's really great to have the community there, and I'm excited for this this meeting and this talk.
I can go next. Hi everyone, my name is Alyssa McGee, and I am going into my last semester at Bloomsburg University in Pennsylvania. I'm studying social work with a minor in child life specialist, and I joined the Beyond Celiac College Ambassador Program in the last fall of 2021, and I agree with everything that Noah said. It's a great program, and I highly recommend everyone join it.
Hi everyone, my name is Olivia Quinby, and I will be a senior at Luther College. I'm studying biology and minoring in dance. And I guess my story with celiac is a little different. I was actually diagnosed in college, and I joined the Beyond Celiac College Ambassador Program a year after my diagnosis, so last year. And it's great because we've been able to network and connect with each other too. So it's a great program not only to be a voice for people with celiac disease, but to also form a connection with students who are also going through the same thing as you.
And unfortunately, Julia will not be able to join us live tonight, but you'll be hearing from her a bit later. She sent a video in with some advice.
Great. Thank you. All right. And now we're going to get into the programming before we get into the breakout rooms. So I'm going to turn it over to Dr. Verma.
Thank you very much. Really excited to join the college students, and I'm sure there are some parents and others who will join us as well. So this is really, really exciting. And we'll go to the next slide. So you have to prepare for college. Next slide. And I always say, do not pick your college based on your disease. Definitely don't pick the college based on the food that you're going to eat. Next slide. So what are the important points? How do we get ready for college? How do we get ready for college in terms of you're growing up, you're done high school, and now it's time to move on and become more independent as well. So some important points that I'd like to highlight. So one of the first things that you want to do is really schedule a visit. We'll go back to the previous slide, please. We want to schedule a visit with your celiac team. Do not add in this visit a discussion about your college's part of your general follow-up sort of appointment. So make a special visit that is just to talk about going off to college and how do you get ready for that. And you would wonder, my God, what are we going to do in this whole 45 minutes with a doctor, dietitian, psychologist team? So there's a lot that needs to be done. One of it is really figuring out what is going to happen to me. I'm no longer under my parents' umbrella. I'm off on my own. What do I do? So the first thing you can do as the student is come prepared with some questions. But don't get overwhelmed. If you don't have any questions, no worries. Let your clinical team help you with that. So what should your clinical team be doing with you? And when I say clinical team, I mean your gastroenterologist, dietitian, psychologist, whoever has been your team as you've gone down the journey of working through celiac disease. So the clinical team should really give you a refresher about what is celiac disease. You know, you would say, well, I've known this for a long time. I've been dealing for this for a long time. And you'll be surprised that if you were diagnosed at 4 or 5 and now you are 17, 18, 19, you might forget what is celiac disease. Why do I have to stay on a gluten-free diet? So thinking about celiac disease as an autoimmune disease is really important because some people have symptoms and some don't. So even if you don't have symptoms, you need to stay on that gluten-free diet because of the autoimmune nature of this condition. So very important to start learning about your disease itself. Why do you need to stay on a gluten-free diet? What are my symptoms? And you may not remember because you were very young, maybe, or maybe you don't have any symptoms. So consult with your parents. They might remind you. You might have abdominal pain, you might have diarrhea, and of course, all the symptoms have gone. So get to know what are your symptoms when you get exposed to gluten. And all of us who have celiac disease, at some point or other, we do get exposed to gluten. Sometimes we have symptoms and sometimes we don't. So learn your disease. Figure out what happens if I eat some gluten accidentally, of course. What symptoms do I get? Then I need to learn about what is gluten. And you think that's so simple, right? Wheat, rye, barley, and some oats. But gluten is in other things besides food. So you're going off to college, there'll be alcohol. So remember, there's gluten in that alcohol as well. So learning about what's the disease, learning about where this gluten is found is important to stay safe. So the next question you may have is, what can I do if I do get exposed to gluten? Don't panic. That's the first thing, is do not panic. Learn from that situation. How did I get exposed to gluten? What happened? And don't do that again, and learn from that experience. But also know what symptoms, what did you get? What symptoms? So if you have nausea as one of your symptoms, talk to your clinical team. They might be able to give you some medications or prescribe some medications that you could keep with yourself as you go on to this journey for college. So based on your symptoms, you may be able to have some medications on hand, but you need to learn that. You need to know that. Then you want to know what else do I need to do besides staying gluten-free? What else happens? You need to get some follow-up blood work done. You need to learn, when was my last blood work done? When do I have my next blood work done? Do I need another endoscopy? These are all the questions that your clinical team needs to help you with. And if you don't have the answers, not a problem. It's up to the team who has to help you learn how to cope with this disease, and also then reflect on what has been painful for you through these years of diagnosis, whether it's 1 year, 6 months, or 10 years. What have been the pain points? Write those down. These are the things that really bother me. This will really help you learn to recognize what your needs are and what do I want when I go to college besides studying. And that's how you'll work with your team to get the letter for college. So how are you going to get a letter for college and accommodations? There's general letters that we have, and we'll go through that as we go through presentation today. But there might be specific things that you may need. And unless you recognize these things, you will not be able to partner with your clinical team to put that letter together. So learn about your disease and then work through with the accommodations. So now you've learned everything about the disease. You've learned all your symptoms. You know what to do. What next? The next thing is you need your medical records. So don't forget, you have to sign for your own records. So if you are in the doctor's office, sign the form that allows you to get all your records. What happens with that is that letter goes to some place called the medical records in an institution, and those records come to you. Unfortunately, that can take a long time. So what can you do? Ask your team. All of us, majority of us are on electronic medical records. Ask them to print up a few things. The few things that you need, really short things that you need. One is if you've had an endoscopy, you need your biopsy reports. So just ask your team to print it up. You need your first blood work that was done, and you need your most recent blood work that was done. Keep that with you. Most of the subspecialists, the pediatric gastroenterologists, send letters to your primary care doctors. Ask for a copy of the letters. That will give your whole story and whole journey that has been with your pediatric gastroenterologist onto your primary doctor. So have them print them out. So basically, that's all you need. You need the biopsies, you need the blood work, and you need the letters. And that's good to go while all the other records are waiting to travel from medical records to you. So those records, you can actually take them with you when you leave the office. The office can pretty much print them for you. You have them in your hand. If you're doing a video visit, a telehealth visit, again, your team can print them out, send them to you through your MyChart portals, electronic portals, all that can be done. And I'm sure you know that. And if you don't know that, this is the time to learn that you want your records with you as you travel to college. So now you say, I've got this bundle of records. What do I do with that? So the big question comes on is when you're moving from one place to the other, you're moving from your pediatric gastroenterologist, a few things need to happen. One is you need to decide and you need to figure out where you're going, and your clinical team can help you. Do you stay with another pediatric gastroenterologist to whatever state you're moving into, or do we look for an adult gastroenterologist? So I can tell you there's different styles for different pediatric gastroenterologists. Some pediatric gastroenterologists, like I will see my patients through college. If you don't go to college, I don't see you. No, I'm kidding. But it is something that some people will see you through college. So talk to your team, ask them what they can do. If they can continue to follow you even from far, make sure you take your records to your health center or whichever is the clinical medical part of your college. Take the records there, talk to the nurses there, make sure they have your records and they have you written down as these are the symptoms you get if you get exposed to gluten, you have celiac disease, and so on. So whatever you learned in your doctor's office when you were making this transition is what you want to tell the nurses in the health center. So choices are go to another pediatric gastroenterologist or go to an adult gastroenterologist in the city that you're moving to, but talk to your primary team. Your primary team will be able to help you. And sometimes we can still see you while you're in college, depending on what else is going on. So that's a discussion to be had. And don't forget, involve your parents. Your parents have been on this journey with you. They can guide you. They will not tell you what needs to be done because you don't want to be told what you need to do, but your parents can guide you in terms of either staying with a pediatric gastroenterologist maybe for 1 year and then moving on and so on. Also, the one thing to remember is if you want your parents to talk to any of your physicians or healthcare team, you need to sign a release that allows the clinical teams to talk to your parents. If you're over 18, your clinical team really should not be talking to your parents. They only talk to them if you allow us to talk to them. So what I want you to remember is that you can do this. You have to own your disease. You have to learn your disease. You have to know how to deal with that, but don't feel alone. We are all here with you. Your clinical team is here with you. Your parents are with you. Your friends are with you. We are all here to help you, but you have to be the captain of this ship. And the last thing I'm going to tell you, and I tell all my patients, and if any one of them is on this line, they'll smile, I hope. Always at the end of the day, text your parent. Let them know you're fine and tell them you love them. And now I'm going to hand over to Vanessa.
Thank you, Ritu. I will second the text your parents. I was diagnosed with celiac disease when I was in between my junior and senior years of college. We didn't have texting then, but calling my mom every night went a really, really long way. So don't forget to do that every single day. So we're in college and what accommodations can we ask for in college? This is probably the most common question that we get asked in clinic. There's a lot of text on this screen. You are going to get a copy of all of these items as well as a template diagnosis letter, so you don't have to worry about scribbling all of these things down. The most important word on this page is the very first one, reasonable accommodations. So there are lots of guides floating around the internet. And if you were to look at every single one of them and put all of them together, you would probably find about 200 different things that every student going to college should ask their university to do for them, most of which are really not relevant to you. So the best piece of advice I can give you is don't go into college and say, here's all 217 things I found on the internet that I found that they said that I should ask you for, because that is the fastest way for them to get annoyed with you and not to really want to work with you. So being reasonable going in is extremely important to start the relationship right. When you're first diagnosed with celiac disease, or if you've been diagnosed for a long time, when you're getting to the college space, the first thing that you want to do is meet with the Office of Disability Services. As I hope everybody knows, celiac disease qualifies under the Americans with Disabilities Act as a disability. So you want to start with the Disability Services Office. This is really important because celiac is a disability. There are things the universities are required to do that they may not need to do for somebody who does not have a disability. So it's really important that we start there. So what are some of the things that we expect? And I'm sorry, everybody, that I'm not looking into your faces. I'm going back and forth between in the room and on the screen. So we want to see a staff member to assist you from the very beginning. If you're going into that university as a freshman, we want them to be assigned to you right away before school even starts, to help orient you to how your university handles a student with celiac disease. This is so important that from day one, you have your person. It makes a world of difference to have somebody in the disability office really shepherding you through the process of figuring out those accommodations, figuring out how you're going to eat safely. The rest of the accommodations on here are sort of generalized items, but they're things that we would, at a minimum, really expect universities to do. So obviously, we want to have gluten-free foods that are prepared free of cross-contact in the dining hall that meet the same nutritional standards as food served to other kids. So what I don't want to have happen is have one of our patients call me and say, the only thing available for me to eat in our dining hall is salad. So sure, salad is gluten-free and there are lots of varieties of things you can put on salad. But if they're offering a hot meal that have proteins, carbohydrates, all of these other nutritional properties in them to other students, we want you to have the same opportunities and the same nutritional values in the food that you eat. Some universities will require that students have to pre-order gluten-free meals, much like if you were not in the celiac cruise group on this ship in the main dining hall, you would be asked to pre-order. This is not a requirement at every university, but I don't want you to be alarmed as if when you get to your university, they say, we want you to order 1 week at a time. At some, I've seen them have up to a month at a time. They'll give you a menu in advance and you can request certain meals throughout the month. So they'll typically have routine things available like gluten-free cereals and options that are standardized for breakfast, but more the lunches and dinners, you would request them in advance to make sure they had ample time to get supplies in. This has been even more important over the last 2 years as there have been supply chain issues. And so knowing further in advance what you may want to eat really helps them plan for supply. Food labeling. I hope that every college is labeling foods. It doesn't always happen. So it's something that we always recommend putting in your plan and asking for to make sure that the dining hall that you're going to be in actually labels food so that you can easily identify what you can and can't eat. We want them to have some sort of standard of practice for how they're preparing safe gluten-free food. Hopefully with food service requirements, this is already in place, but we want you to ask to see this so that you make sure that you know there's some protocol being followed and that you're comfortable with how they're making the food. The level of protocol varies greatly between schools, but we want you to see what they're doing so that you make sure you're comfortable and can ask questions about it. We want the food service staff to be trained. This is so important as there's so much turnover in food service workers that we want to make sure there's some element of celiac training that goes into their annual reviews. Provide a dedicated space in the main dining hall to store and prepare gluten-free foods. So this happens in different ways at different schools, depending on the size of the kitchen and the way in which they have dining facilities set up. It's not always possible to have a dedicated space. And so this is on our standard form, but we ask that when you meet with your university, if they, oh, we can't do that, to not just say, but you have to do that, to rather express it as, okay, can you talk to me about how you're going to do it safely? And, show me if you're not going to have a separate space, how you're going to make sure that my food is not going to be contaminated with gluten while you're preparing it. One of the big things that we hear about, mainly from universities that contract their dining spaces to outside restaurants. So instead of having a traditional dining hall, you'll have a cafeteria style where the different stations are bought out by restaurants or other vendors who staff them. We want to make sure that if that's the case, that your meal plan can be used at places that have gluten-free food options. Oftentimes when they're individually owned stations within the dining hall, your card will not work for different gluten-free options. And so we just want to make sure that there's always a vendor that has something that you can eat. So this actually came up pretty recently. If gluten-free food is not available, provide student with access to housing with a fully equipped kitchen. So we had 2 students this year that we worked with where the dining hall repeatedly had issues and served them gluten, leading to hospitalizations, and they were very, very sick at school. And so we actually had to help them with getting new housing and a fully equipped kitchen. And so that's really a last resort. If your school offers a dorm with a kitchen, that's awesome. Most don't to freshmen. And some don't until you're a junior or a senior. And obviously we want you to dine in an environment where you're with your friends. We want this to be as normal as possible. We want you to go into the same dining halls, to the same eating spaces, and be able to have as normal an experience as possible. So if we can not have this happen, that's where we want to go. Often students who go this route from the beginning find themselves feeling very isolated. And so we want to keep you in that normal environment as much as we can. So the refrigerator, almost every dorm room has a refrigerator that comes with it, and a microwave. One of the most common things we hear students ask us for is, can we request one that is just for me so that I don't have to share that with a roommate? If things spill in it, if there's confusion on the gluten-free and the not gluten-free version, we would consider this a very reasonable request to ask for your own refrigerator and microwave. Unrestricted access to the bathroom, just as we would for any child of any age. If you need to go to the bathroom during a class, we want you to, have the flexibility to do so. And also during testing, should you need to do so. And then we really want the Office of Disability Services to work with you. We don't want them just to hand you a standard plan that they have for every kid with celiac disease that's ever come through. We want you to sit down and talk with them and build a plan that works for you. While it's helpful to have something to start from, we really want you to think through what you need to be successful so that it really works for you throughout the year. And also don't be afraid, as if your first plan is not working or you feel like things are missing, to go back and ask for support along the way. We'll talk more about this later, but Ritu and I, we support our patient families all throughout the school year. We get calls all through the terms, asking questions. Is this reasonable? Is this unreasonable? Can you help us with this? Don't ever be afraid to reach out to your healthcare team. We're really happy to help you. And I'll tell you, universities do not like hearing from Boston Children's Hospital or the University of Chicago Medical Center saying, like, you're not doing this right. So, they really do want to do well for their students. All right, next slide. So how do we get to these accommodations? So your first step is simple. You get the diagnosis, and that diagnosis, diagnosis letter that Dr. Verma talked about. If you don't already have one, we do have a template letter that's going to get circulated with the materials from today that is a fill in the blank. Sometimes we hear that not every hospital center is providing a fantastic detailed letter, and so we do have a template that we can share with you to share with your own physicians. Once you have that letter, you have to let the university know. This is a simple step. Again, we're going to start with the Office of Disability Services. We have to work with them to create the plan. This could be through a series of meetings. If you're already in college when you're diagnosed, this is a little different than if you're an incoming freshman. If you're diagnosed when you're already there, you're obviously going to set up that meeting with Disability Services at that time. If you're a freshman, or you're still applying to colleges and going to be looking at them, it doesn't hurt to even meet with this office as you're looking at schools to just talk to them about their process and what supports are available to you. You would then create the plan. It would get written so that you really understand all of the accommodations that are available to you and how to access them. When I talk about what kind of detail we want to see in this plan, we want to know who you're going to go to in the dining hall. Is there a chef that you go to every day? Is there a certain area that you go to every day? We want it to be really well thought out so that you know exactly how to get access to the food that the safe food for you. So then once the plan is written and everyone's happy with it, it will get put into action, and hopefully it will go beautifully and you won't have problems throughout the year. I would say more often than not, we have good outcomes. If you have problems, of course, you can request a meeting at every time. And then at a minimum, before each new school year, you'll want to meet with them again, just to make sure that the plan doesn't need updating or modifications for the new school year. The one question I will encourage you to ask at every update meeting before the school year starts, and you might want to do this even like a month before school: has the food service provider changed over the summer? Because this is the rudest awakening, is when you've had this great thing going for the last 2 years or your first 2 years in school, and then you get there for the first day of your junior year and you walk into the dining hall and everything is different. And so it helps to ask these questions in advance so that we don't get to school and then be shocked and then have to start from scratch and then not know what to eat for the first week being back. So it really does help to ask these questions before you get back for the new school year. All right, we can go to the next slide. All right, so excused absences and missed tests. This is a very messy paragraph that I am not going to read to you, but perhaps one of the most common things that we get asked from students is for us to write them a letter globally excusing or giving them extended time for every single test and unlimited excused absences from classes. So Dr. Verma and I are part of a consortium of pediatric children's hospitals with celiac centers. And so we put together this statement about it because we hope that you never have to miss a test or that you never have to be absent from a class because of celiac disease, because we want to see you on a strict gluten-free diet, not having cross-contamination. We also recognize that real life happens and mistakes happen, and it is not unusual to have these things happen. So the conversation that we typically have with our patient families is to say to them that we understand this will happen, and that in the letter we're going to provide you, we will, write that at times you may need accommodation for these things, but that we don't anticipate them happening on a regular basis. And we hope that our families, and I don't know, Ritu, if you've ever had problems with this, I've never had problems with students abusing this, but our goal is really to set you up for success so that you have the right access to food, and that you can really thrive and be healthy in the college environment. Of course, as I mentioned, we do have issues that come up, and we work really closely with those families to get their needs met so that their students are able to fully participate. Ritu, did you want to add anything on that, or?
I was just going to say our students learn so well, they don't do these things. They all attend classes. and I think that if there are these situations that arise, then we help them through with that. So I think we haven't needed this much.
Yep. All right, so now we are going to jump into the really fun part of today. So we are going to have a workshop. Megan is going to split everybody on Zoom into 4 breakout rooms, and our cruise group is going to be our own breakout room. And we're each going to be assigned a different case of a college student experiencing a problem. And we're going to workshop how this student can get help and what they should do to get on the right path to success. So do we want to quickly just run through the cases? All right, so case 1, Jesse's college dining hall has limited gluten-free food. Jesse is a freshman at a small private university. He came to school with a 504 plan from a public high school. He was told during orientation that there were plenty of gluten-free options in the dining halls, and just to ask when he arrived for meals. Jesse has been on campus for 1 month, and the only regular options are a salad bar, though the way it's set up, there is risks of cross contact with croutons, wontons, and gluten-containing pasta in the same area as the produce. He can have white rice at the international food stations with gluten-free soy sauce, a hamburger, hot dog, or grilled chicken with no bun, and gluten-free granola bars at the coffee shop. And don't worry, you don't have to remember all of this. When you get into your breakout groups, the cases will still be up on the screen. All right, case 2, Maya doesn't like the options in her college dining hall. Maya is a sophomore at a medium-sized university in Chicago and was just diagnosed with celiac disease by a local physician. She met with a university dietitian who gave her a list of safe gluten-free food options in the dining halls, but Maya doesn't like them. Most of the options are very basic: salad, gluten-free sandwiches, and grilled items, but no creative food choices like the other students have: international foods, featured meals of the week, and a chef-inspired monthly menu. Liliana keeps getting sick. Liliana was diagnosed with celiac disease at age 5 and has been on a gluten-free diet for 14 years. She chose her small university in New York because they offered many gluten-free food choices. Liliana is a freshman and has been on campus for 3 weeks. She has been to the ER 4 times with severe vomiting because of ongoing gluten exposures in the dining hall. She has met with dining services, disability services, and the campus dietitian for support, but continues to get sick. Elliot is sick at school and needs help. Elliot is a sophomore in college and has successfully been eating gluten-free for the past year. At the start of this school year, a new food service provider took over, and Elliot has been glutened at least 3 times. Currently, Elliot is recovering from a virus and was glutened by supposedly gluten-free chicken noodle soup provided by the dining hall. Elliot has been vomiting for 3 hours and feels miserable. He doesn't know who to call for help. All right, so Megan, if you can split us into the breakout rooms.
Yes, I hope this works, everyone. But you will need to kind of nominate a spokesperson. You will have the ambassadors with you. So we need someone to kind of present to the group at the end. So work through these case studies and we will report back in about 15 minutes. All right, so I think
We're getting out of the room.
back now. Okay, so I'm really excited to hear the feedback from everyone's breakout groups. So why don't we actually start with the celiac cruisers? Why don't you guys go first?
All right, Megan, are you able to share that Google document? Or you know what, it's okay, I'll just put it up here.
Okay.
So Garrett is reporting back for us.
Yes.
Yeah, Valerie, do you want to put it on that case study 4?
Yes, absolutely.
Okay, so we'll get on.
We're on number 4. I'm going
Oh,
reverse.
that's right.
There you go.
Can everybody hear me okay? Or do I need to be louder, closer?
Can you hear Garrett?
You're good.
Okay, perfect. So the first question was, how do you think Elliot is feeling right now? We said he feels horrible, sad, depressed, alone, unsupported. He probably wants to go home and he's feeling really anxious after being sick for that long. What steps should Elliot take to get help right now and improve the issue of gluten exposures? The first thing we said was, obviously get medical attention, call disability services, his parents, his RA to get help. And he should go straight to the school health center to see what they can do for him, or if they suggest going to the emergency room. Call his pediatrician or GI team to ask what his next step should be. And one of the main things we talked about was to not hide in his room, not be ashamed of his symptoms, and to, voice the issue at hand. When he was calling the doctor, we talked about what he should tell them, how long he had been sick before throwing up, how long he's been throwing up, what medication he's taken for the virus. If anyone else is sick in the room or in the dorm, does he have a fever, and has he kept down any fluids? Because you do need to differentiate between the gluten exposure and virus symptoms, because he might have both. After all that is taken care of, something he needs to do is make sure that the staff with the new food service, provider is trained in how to be celiac safe. So talk to the disabilities team at his college, and maybe think about changing his meal plan to something more flexible, and maybe even outside of the college if he needs to. One thing he can do is ask to see boxes of food to confirm whether or not they are gluten-free, or if it was just a mishap in communication or something inside the kitchen. And then are they actually separating the gluten-free and gluten-containing foods in the dining hall, or was this a cross-contamination side effect? All right. Our last question was, what problems might Elliot run into as he works with his university? So they may think he's asking for too much, being a little bit over dramatic. But one way to fix that is, talk to your team and have a doctor write a letter detailing needs and symptoms so they know that, okay, this is a real thing that's happening. School could say it's not gluten exposure, it's just the virus, and he should just, go back to bed. And one plan we had for that was to keep a log of everything that you had, symptoms and what you think you were exposed to. It's like what the food was, if anyone else was sick, and then when that happened. Another way the school might run into a problem is they don't have any way to improve his experience. And so with that, they could refund his meal plan, request housing with a kitchen. And I do actually know that some schools offer meal plans that let you go out into the surrounding area to buy from restaurants there. And then our final problem is just the staff may not have been trained to handle, this allergy.
Thank you, Garrett. The last thing I'll just quickly add is that we talked a little bit about connecting with other students at the school when you're trying to differentiate if it's, a virus, you ate something bad, or if it was a gluten exposure, so that you have a way to get in touch with other students with celiac disease. So maybe through social media channels or a facilitated meetup to find other students with celiac.
Great. There's a lot of good stuff there. All right, let's go to case study number 3. I guess I'll go in reverse order.
Sorry, I muted us before Maureen shouted out. Thank you to Schär for all of the treats. We are all enjoying hot cocoa and honey grams and twin bars here as we had this discussion.
I love to hear it.
So we discussed case 3 in our breakout room. And everybody, really agreed that Liliana is taking the right steps by already speaking with dining services, disability services, and the campus dietitian for support One issue she may be running into is that there's just a lack of understanding about celiac disease. Oftentimes, food service professionals are trained about celiac disease in a way that is very much, these are the things you have to do to prevent cross contact. They don't actually understand that celiac disease is a really serious autoimmune disease and can cause some really awful symptoms. They may be thinking gluten-free, like it's a diet trend. And so sometimes just sitting down and explaining the consequences of not eating something that's entirely gluten-free can be really helpful in getting everyone on board and understanding why it is so crucial to have gluten-free meals. Something to also bring in perhaps is your own doctors, if they can help speak on your behalf, disability services in the event that some additional accommodations are needed at this time. The case study mentions that she has been in the ER multiple times. If that is impacting her attendance or her schoolwork, it may be some things to consider for some temporary accommodations. And then unfortunately, the last thing we do discuss is if there are just no answers with finding anything getting better, then it may be time to look into getting a meal plan exemption. And like the Celiac Cruise mentioned, either finding a way to see if your meal plan can apply for places off campus, or if you have to get an apartment with a kitchen.
Great. And one question that came in through the chat that I think this might be a good place, and Dr. Verma and Vanessa, I expect you'll be able to answer this, is do you think meeting with disability services prior to acceptance to a college impacts the admissions decision? I'm going to say it shouldn't.
Well, yeah, I mean, is this a decision from the patient, from the child, or the family, or is it from the college?
So I think it's the college admissions decision. It should not, correct? Because
It should not. It should not, and I honestly don't think it does. So I do believe that the more open you can be about that discussion prior to, if you are thinking about a college, is really important. It should not.
Yeah, and in your experience, have they been pretty open when having these conversations?
Absolutely. I don't think there's been, there's some colleges it's easier to talk to them, and in some colleges it takes a little effort, but that's okay. As I mentioned, your team, it's a whole team. You are the captain of the ship, but we are all part of the team, and it's for us all to help get you in the college that you want to be in. I just want to say about this particular case, I know we're talking celiac disease and gluten, but not to forget that other conditions can also arise. You have celiac disease, you can have another autoimmune disease. So very important that if Liliana keeps getting sick, that it's important for someone to look beyond celiac and beyond gluten as well. And of course, you look for gluten as the reason, but looking at other conditions would be important as well. So not just to sort of have tunnel vision with that.
Yeah, good point. Thank you. All right, so we'll go to case study number 2.
This was my group's case. And so what we discussed was meeting with the dietitian and, if possible, the dining executive team as well, and having a clear, like, specific list of foods that you like to have and like what you like to eat. And so meeting with the dietitian and discussing that list with them and seeing if there's ways in which to make those like food options possible at the campus. And we also spoke about trying to reach out to some other brands as well, some other gluten-free brands that you really enjoy, and trying to find ways in which to have those products integrated into your dining markets and dining halls. And so, for instance, at Vanderbilt, what we did is we had actually an event with Schär. And so we actually had a huge French toast event. And that was just one example of like a big event that we had, where we had a bunch of gluten-free options present on our campus, and it was really helpful. And another thing that we discussed was trying to connect with others with celiac disease and finding your like allergy group in a sense, and going to org fairs and trying to find an allergy council in a sense, which is something that exists at Vanderbilt. And that's like one of the ways in which you could find and build the network of fellow celiacs to kind of discuss this with as well and try to work towards solutions for.
I think, Noah, that's an excellent point in terms of finding your network. So if you may not have an allergy group like you mentioned at Vanderbilt, again, getting to know other people, get engaged with your community, because then you find the ambassadors, you find the groups, and you learn. And if your college does not have it, learn from Vanderbilt or from another place and build it, make it your own. And it'll help you, but it'll help anyone else coming behind you as well. So I think that's a wonderful idea. And this, again, the network of ambassadors in whichever group or support groups or joining those kind of things are very helpful. And if you're in a city that has a big celiac center, even reaching out to them, even if you're not their patient, I do believe that anyone would help. So I love that idea of just networking among the youth themselves.
Yeah, and actually there's a question in the chat directly about this, that someone's son is attending a private boarding school in Massachusetts this fall. Is there a good point of contact at Celiac Connection, Boston Children's Hospital? Yes, we can connect you with Boston Children's after this. I'll take down your name, Milo.
And
Call
Francie just put
Vanessa.
our
Call
email-
Vanessa.
And thank you, Francie put our email address in the
Yeah.
chat.
Yeah, perfect. So you can reach out to Francie, celiac@childrens.harvard.edu. And then someone also just said another Boston area question, that at Boston College, they weren't allowed to meet with the dietitian until she was accepted, but it all worked out and was stressful. I'm sure that, you know, different colleges have different procedures, and navigating that is really hard, but it is nice to know that you eventually were able to meet with the dietitian. And I think majority of the time that's the case in all of our experience, but yeah,
Megan, I just want to add to that, this is another reason why you should reach out to a celiac center in the city where you're going to college. So they may have told you that about Boston College because you weren't there yet, but our celiac program at Boston Children's talks to Boston College like maybe once a week, you know, with for other patient families that we have going there. And so you may be able to either meet with them or have a facilitated discussion, or at least get information from the celiac center in that area who may work with them on a regular basis. So
yeah, and on that note, a lot of the celiac centers are very well connected with each other. So if you don't know how to reach out to them, reach out to your gastroenterologist or your pediatrician, because it's very likely, like, look, we have a lot of celiac centers represented, I can see. So see if they know anyone in that school.
And we all talk to each other all the time. So seriously, don't think that we'll be offended if you want a recommendation to talk to one of our colleagues.
I think we're all supportive of each other. We know that if you are normally living in Chicago, but moving over to Massachusetts or somewhere there, that reaching out to Vanessa does not mean that we would get offended. And in fact, we would help you and say, that's a place you want to go to. So again, how do you find a celiac center? You could pretty much find if there's a big academic center wherever you are, and you just go on their website and see if there's a celiac center. If you call and they seem not knowledgeable, then I would hang up politely and then call your team back wherever you started and ask them to tell you. But there really are a lot of good big centers and small centers that are celiac centers across the country. And one of the things on a different platform, both Vanessa and I are part of the SSCD, and we are working on trying to get some centers up and going, and really will hopefully at some near future time publicize which are the big centers and how to call a center. So that hopefully in the near future we'll get more information. But call your own team, they'll tell you, or call any big center, or get in touch with support groups. I think that's the best way to find a group.
I'm putting my email address in the chat. For all Boston related questions, feel free to reach out to me. My email is there.
For
Yeah,
all
great.
United States questions, reach out to Vanessa.
Yeah.
In international waters.
That's
Am I
true.
in international waters right now, or is this like
I think we're
we're
almost in
Canadian?
Canada.
We're almost in Canadian waters.
Love it. So there's a lot of questions. We will get to all of them, but the next question I have on here is actually kind of related to the first case study. So I'm going to turn it to the first case study, and I think Jocelyn's going to be sharing and Alyssa together on this one.
Sure, thank you. So, I mean, to start off, we imagine that, Jesse was, pretty feeling pretty isolated, kind of disappointed, frustrated with what was happening, coming from his high school where he had the 504 plan, he had something in place. Now, he might feel like he's starting from scratch or really has to start all over new. So, Alyssa was able to share some kind of similar experiences, but, his case, we'd want to make sure that he's done all of those recommended steps. So registering, with the ADA, seeing what kind of, food service team he could reach out to, what kind of accommodations they're able to offer him. Maybe that means reducing his commitment for the meal plan. Maybe it means, bringing in some additional menu offerings, maybe giving him access to more of a kitchen. So, just exploring what kind of options there would be for him. I will turn it over to you, Alyssa, if you want to share some of what you went through and found, helpful at a small kind of school similar to this.
Oh yeah, thanks. Thank you, Jocelyn. So yeah, I told my story a little bit. And we also talked about the 504 plan. I never had one in high school, but we did discuss if you would need one in college or not. So I didn't have one, so I kind of went to college without any idea of what to do. So I did reach out to disability services, and they didn't really tell me much other than like I can just like register with them as, having celiac disease. And I reached out to dining, and unfortunately they never got back to me. But I also reached out to Student Life on my campus, and they were great. They gave me a lot of resources and a lot of different people to reach out to. So they definitely were an option for me. But I kind of had a similar situation. I had a lot of cross-contamination in my dining hall, and we kind of had the same things. We had like rice and potatoes and like chicken. So the same meals every single day were available. And we never had like a gluten-free dedicated area. But I would just say exactly what Jocelyn said, like reaching out to all the different resources on campus, because at some point, like you don't just want to be alone, like you want to have all of that support with you on campus.
Yeah, great. And just for some of the questions related to this case study, they say, what if a college only offers product brands that we are uncomfortable using? For example, we are uncomfortable with Bob's Red Mill because of potentially shared lines. By the way, hi, Dr. Verma. So this is one of your patients. So how would you respond to that? Because I think this goes along with like, you're not getting the options you necessarily want. How would you navigate that?
So I think, hi, Gary, how are you? Hope things are well in Philadelphia and New Jersey. I really think, and going back to Alyssa as well, you shouldn't have to do this all on your own. Honestly, you should be able to pick up the phone and talk to your clinical team, have your dietitian in your center, pick up the phone and call. And I think it goes a long way when your own medical team picks up the phone and talks. So no one should be just living the whole year on salads or rice and potato. And no one should have to struggle through trying to find the food. So pick up the phone, call your team, don't feel bad about it. It is part of what we are here for. And a dietitian, a physician, a psychologist, whoever is a member of that team will pick up the phone and talk to the dietitian in the college or the chefs or anyone like that. I just think you have to empower yourself that you can do this. This is needed. And this is not you asking for a favor. This is what we would do if someone was on medications that they needed for their disease. And let's say the insurance is not covering. What do? We do a lot of pre-authorizations and prior authorizations, and we do a lot of things for the medication. So this diet is your medication at this point. So don't fight with it alone. This poor Jesse, if you had to go through all that, I think it's important Jesse should have picked up the phone and talked to his team, and one of that team should have called. And if your team is not helping, then call Vanessa. No, then you can call Vanessa, or you can call me. I mean, honestly, it's something we need to be there for you, and we will be there for you. So you have to do a lot of legwork, you have to do some work, but then when you've reached your limit or even before that, give us a call. Let us help you with this.
Yeah.
So I'll just
definitely.
add to what Ritu said. So in terms of the question about specific brands that you don't like, I have had this question before. I think there's a couple of limitations. So first of all, if it's a brand that is labeled as gluten-free and is meeting the FDA's standards for labeling of gluten-free, that's the standard for which, you know, the food service provider is looking at. And so I think in these situations, something that you can do is ask them to look at their ordering list and see what comparable products that they have from other vendors. Most do have more than one option for, you know, gluten-free bagels, for example, or pasta. And so to see if there's something comparable that they could order in its place. So I think that, you know, that's a really kind way to do it. I know Megan's going to talk a little bit more about bringing in products to universities in a minute. The one other thing I just want to touch on, the 504 plan piece, is that one of the reasons we really advocate for high school students having a 504 plan to send to college is that 504 plan lists accommodations. And if your college's Office of Disability Services isn't super familiar with celiac disease and doesn't really know what that means besides just registering you as a disability, sometimes it's just like a check mark. They say, okay, we have this student has a disability, and it just goes in another pile. But if they get that 504 plan with your file that shows these are all the things that were already being provided, it just sort of like a trigger for them that, okay, these are the things we need to start thinking about. It's also a helpful starting place in having those discussions of building the accommodation plan. So while it's definitely not required, it's definitely a helpful document to have in place.
Great. And I think with that,
If I can just add one thing, Megan, I mean, there are many times that we actually will say as a clinical team, you need to have a 504.
The fuck
But
is that talking about?
I do hear from parents or children saying, I don't need one because I don't eat in my high school. So therefore I don't need, and I don't have any symptoms and I don't need. And I think what Vanessa has said is really, really key, that whether you need it or not, just get that 504 and get started with it.
Okay, so Megan, is it okay if we just quickly address the health plan and IEP questions? Okay, so a health plan is not a legally binding document. It's just a plan that is to guide the school nurse in providing a minimum standard of care to a child with a medical condition. So it does not have any legal implications in the same way that a 504 plan does for somebody with celiac disease. So the 504 plan is really the right type of plan. Now, the next question is about an IEP. So an IEP is used for a student who has a learning disability, and it is a legally enforceable document. So if you have an IEP, you can include celiac disease within it, and it would be enforceable in the same way as a 504 plan. So that the IEP is sufficient if that's the type of plan you have.
great. And I see that Nikki is commenting as a dietitian on the West Coast. So, you know, she's going through this with her son. So definitely she can be a resource for you too, for the West Coast folks. All right, I'm going to ask Valerie.
Also, I just want to add, there's a very good celiac center at Stanford. There's also a great celiac center at Seattle Children's Hospital, and I'm happy to connect folks to those colleagues as well.
Oh, perfect. That's great. All right. So I am going to ask Valerie to move the slides to the next part, and we'll go back to the questions in a little bit. But we wanted to have a quick discussion on roommates because I think this is a pretty big challenge. So go ahead, Valerie.
Yep. So this is one of the most common questions we get. Should I live with a roommate? Should my child live in a single dorm? Should they live with somebody who has celiac disease? Should they live with someone who has a different allergy? Should they live in a kitchen? And it's a very individual situation. There is not one recommendation that I or any of us can give. It's very dependent on individual factors, like what your celiac disease symptoms are, if you have any other diagnoses beyond celiac disease, but also factors like what your college even offers, what the freshman housing even is. And, you know, especially wanting to make sure that you are living amongst freshmen and having that freshman experience. So regardless of what makes the most sense for you, I think the most important thing to start with is to find out what your options even are at your college. What are the room situations? Are you allowed to pick your own roommate? Are all the roommates randomly assigned? And no matter what you end up deciding to choose, set yourself up for success. Be proactive, have conversations early, think through all the different possibilities, make a pro and con list. And when it comes down to living with roommates, remember that this is not the only thing that you are going to discuss with your roommate. There are a lot of boundaries that you will discuss with your roommate, like sleeping arrangements and study times and bringing in significant others. And celiac disease is just another thing to discuss. So our ambassador, Julia, who was unfortunately unable to make it tonight, left some words of wisdom about her experience. So I'm going to play that all for you.
Hi, my name is Julia, and I'm a rising sophomore.
Valerie, you've got to unmute. We lost the sound.
To this.
Sorry about that.
Hi, my name is Julia, and I'm a rising sophomore at Northwestern in Evanston, which is really close to Chicago. I'm so sorry that I couldn't come to this virtual event. I actually have to get my wisdom teeth out, which hopefully should go okay. So my freshman year, I lived in a super nice dorm. We called it Hotel Lincoln. It was like recently built in 2017 and it's suite style, which I got, which I requested with a doctor's note, which I 10 out of 10 recommend because it means that you don't use a communal bathroom. So I only shared a bathroom with 3 other people. The transition to college with celiac means that you're just going to have a lot of food in your room because you're going to like house all your gluten-free snacks and everything. So I ended up getting a second fridge that was just for my stuff because I originally was going to share one with my roommate, but I had like too much food that I was hogging all the space and I felt bad about it. And I'll say that like living with a roommate is definitely doable. My roommate and I are friendly, but not great friends, but that has nothing to do with the celiac, just like roommate differences, like going to bed at different times, etc. I will say that I think it's really important to talk to your roommate about celiac and what that is before you move in. And like there are certain things that I had to explain to her, like, hey, I'm happy to share my snacks with you, but you can't put your hand in the bag. And my snacks are going to have to go on the top shelf because the crumbs from yours can't fall onto mine. And they should be like very respectful and understanding because they don't want you to get hurt or sick or anything. Next year, I'm living in a sorority house in a single, again, with a bathroom. Just in case I do get sick, then I don't have to be in a communal bathroom that you share with 20 other people. And I will also have a fridge, and both my dorm and the sorority house that I will be living in last year had a communal kitchen. So I have like a toaster and pots and pans that I keep separate in my room. And then when I want to use them, I just bring them to the kitchen. And then I have my own gluten-free sponge and so forth. Anyway, I would say that celiac in college is not that different than celiac at home. It's just learning how to explain it to others, because for me, at least, like I was diagnosed with celiac when I was 12. And so all of my friends like in high school knew that I was gluten-free and knew what celiac was. And I didn't want to have to be like the gluten-free kid at college. But I learned that like, okay, in social situations, I might have to do things a little bit differently, like eat ahead of time or call the restaurant. But that doesn't mean that you still can't hang out with your friends or you can't have a roommate. It just might take a little bit more planning. But college is so much fun and you all are going to love it.
So she said it better than I could myself, and she's living it right now.
Hi, my name is Julia.
We'll go to the next slide.
Awesome. So we're just briefly going to talk about how Schär can help, because this is something I feel very passionately about. And we've been doing a lot in partnership with Beyond Celiac. So I'm a registered dietitian, and sometimes that can be helpful. So I have called schools before. I'm not your medical provider, but I can call and ask them if they have a gluten-free option for sure. We also support students in a variety of ways. So I am a good resource for training campus dietitians and dining services. We've worked with different colleges to help them get their staff trained. And that is hugely important. I think a lot of colleges want to do it right, but they don't necessarily have the training. And so Schär can help support you in that. You will have probably my communication, my contact information after this. I'll share it with everyone because I'll be sending out the post-event emails. So if you're having trouble and you feel like your college doesn't have the right training, you can reach out to Schär. We also, can help you with events. I think this can be a really fun way to introduce people on campus to celiac disease and the gluten-free diet. This is a picture of one of the student ambassador events that we had. It was basically just a sampling table with, gluten-free treats, and that type of event can really help everyone involved, help your roommates understand your situation, help more professors, dining services, your dietitian become more aware that there are gluten-free students on campus. And so we also worked with NOAA. We did a little, we called it like a kitchen takeover, but it was basically just that we had gluten-free French toast for a day. That brings awareness to celiac disease to everyone on campus. So we also do a lot of things specifically with Beyond Celiac. So Valerie is going to talk to you a little bit about the Beyond Celiac Student Ambassador Program, but we'll actually set students who are in that program up with a little sample box that also has some educational materials in it. So Valerie, if you click through to the animations, I want to just share briefly what some of the resources we have are, and I will also be sharing these after the presentation. But we have a dorm recipe book. So Nikki, for your question about teaching students how to cook in shared spaces, I think that's a great suggestion and something that probably the celiac centers do have a little bit of resources on, but we also have a little recipe book, like we call it like dorm hacks, things you can actually cook in most dorms with a microwave and a mini fridge. But I agree, we need more resources like that. We also have an advocacy guide. So if you didn't have a 504 plan in college, we've created a little booklet where it can give you some tips, a lot of what we've covered today, but we have templates in there and different ways different ideas for communicating with colleges. And then this handout in the middle here, the resources for your dietitian, this is included in the sample boxes that we work on with Beyond Celiac, but also I will be sending this out too, is that we have the information about how we will work with your dining services to get trainings. So I think someone actually just asked this in the chat, does Schär have training specifically? We don't, but we work with a company who is really experienced in training food service establishments on how to handle allergies and gluten-free diets. That company is called Menutrinfo. So that is kind of I connect. I'm a good person to help connect the dots if you're struggling, and I'm happy to help. So Valerie, if you want to go to the next slide, I also want to share another resource because the team at Columbia actually reached out to me saying they were really interested in coming tonight, and they work with Find Me Gluten Free, and Find Me Gluten Free now has a college section that, Find Me Gluten Free is a resource, but it really relies on people to send in reviews and to share their experiences. So I encourage you all to check this out and start using it, because the more people use it, the better of a resource it will be. So this is a new one, but I think could be very helpful. So thank you to the team at Columbia for that.
So I'm seeing a lot of questions in the chat about the Beyond Celiac Ambassador Program, and I'm super excited to kind of share more about this. We've got some photos on here on the left. These are from our 3 ambassadors that are on our call tonight, Alyssa, Olivia, and then the Schär Toast is Noah's event. But our Beyond Celiac Student Ambassador Program serves as a platform for our most passionate individuals in the celiac community. Really what this program was born out of is knowing that there are folks who want to do more to spread awareness of celiac disease, who want to make change in their communities, and they either just don't know how, don't have the platform to do so, or a lot of times at this age, sometimes the issue is not being taken seriously as a young individual with celiac disease, not being seen as somebody who, has the experience or has the knowledge of the disease. And so our ambassador program is quite small. Right now we are at 36 ambassadors, but it is kept small to ensure that I, as the community engagement manager, have the opportunity and the time to work with each ambassador one-on-one to design a personal project. Now, what this personal project is can be up to whatever your interests are in the celiac field, whether that is general education and awareness, whether that is working with people who are newly diagnosed, or whether, like our college ambassadors, it is working on your campus to increase awareness on your campus, increase options, and overall make your campus far more celiac friendly. So again, this is something that allows you to have a platform to work with dining services on your campus, host events, increase availability and options. Sometimes we do find that just having the backing of being a Bali Celiac ambassador helps you have a little bit more of oomph when you walk into dining services, a little bit more of a platform behind you as an authority on somebody with celiac disease, although you should be an authority just from living with it. So of course, I understand that the ambassador program is not going to be for everybody, and the ambassador program may not be for you if you are just starting out at your college and are trying to get your bearings. So there are a ton of other ways that Beyond Celiac can be helpful for you. One that is probably our most apt is our gluten-free and college student toolkit. This is a free resource that we've put together that is kind of a crash course on everything you need to know before going to college with celiac disease. It does have a lot of the things we've covered here tonight. It also has things like specific questions to ask dining services, some further considerations about accommodations in that process, as well as some of our own sort of gluten-free dorm cooking hacks. We also have some town hall virtual series. These are continued education with different physicians in the celiac disease field, answering questions about other conditions, answering questions about research. And these are things that you can sign up for. We have them about every other month. You also can connect with us on social media. We are always posting things like snippets from our podcast, tips, some things that our ambassadors are up to and more. And lastly, I want to offer myself as a resource. I actually just graduated in 2021, and I do have celiac disease myself. So not only am I familiar with working in this field through my role at Beyond Celiac, it is something I've done quite personally, quite recently. So I do have my email there. That is also my personal cell number. And I do want to emphasize, please do not hesitate to reach out with any questions that I can help with. Again, as Megan mentioned, I am not a medical provider either, but anything that is a non-medical question, just in regards to questions to ask dining services, or anything else that you'd like our help on at Beyond Celiac, I am happy to help in any way I can.
Yeah, and Valerie, while we're here, people are asking about the process to apply to the ambassador program and if you're accepting new ambassadors and if high school seniors can join as well. So can you just briefly talk
Yes,
about that?
absolutely. So our ambassador program is actually all ages. We specifically picked our college ambassadors to be on the call tonight, but our youngest is actually 11. So yes, you can absolutely be an ambassador in high school. When we send the follow-up email out, there will be some information and a link there about the ambassador program. But right now our program is rolling admission. So instead of having an application and kind of a cohort, if you're interested in the ambassador program, simply what you would do is set up a call with me, and you can do that by emailing me. Again, my email is right here and it will also be in the follow-up email. But during that call, we'll kind of talk through what your interests are, what you'd like to do with your platform as an ambassador, and also some other volunteer options if perhaps an ambassador isn't something that you feel that you have the time commitment or even necessarily the desire to do. The other option we do have is connecting you with one of our current college-aged ambassadors if there's somebody who is either in your city or if there's somebody who's out of school that you are looking to attend. We've sent many students over to our college ambassadors, and I know they'd be happy to share their experiences on campus.
Great. And there's one question in here for me. Does Schär offer these services to private high schools? I'm happy to help. In the follow-up email that you'll get from me, you can just reply to that and you'll have my email. I'm happy to do what I can. I'm seeing a couple of comments and questions about getting your own kitchen and the benefits of that, and also thinking about the cost of that, right? You're a little more isolated, and you're also potentially spending more money on gluten-free food. So if anyone can, any of the hosts can comment on how they've helped students navigate getting their own kitchen for their dorm.
So I, for one, do not recommend getting their own kitchen in their freshman year. I just think that at that stage, you want that college experience. And, if you're not in the freshman dorm, you're not with your peers. So I really think that first year, and then you're just learning the whole college experience. You don't have enough time to be sitting there and cooking and so on. So I really think that as a freshman in college, you should not have your own kitchen. You should be with your own group and work through with the kitchens. And everyone has heard all the resources that are available. And again, I have not put my email on it, but again, I am available for anyone, whether I see you as a patient or not, or whether I've seen you in the past or not. If there are any questions, I can safely say that all four of us on this webinar here are willing to help anyone. Post that, when you are in a higher sort of hierarchy in your college, then I think having a kitchen is not a bad idea, but then you want to be educated to get more of those naturally occurring foods. So those are not as expensive as you would if you are getting, a loaf of bread or something. So I think learning to cook with basic foods is probably the way to go. And I think I'm going to put Vanessa on the spot. When we were in that celiac breakout with the celiac cruise, she had a mention of a book. So Vanessa, what's that book that you got?
So I agree wholeheartedly with everything Ritu said. I advise people to avoid the solo kitchen as much as possible and to really have that normal experience. It really is possible. The book I was talking about that my mom gave to me was Help Mom, I Have a Kitchen Now. And so it's the most basic of basic recipes. And, one of the things that I learned quickly is like a rice cooker that is like, doubles as a steamer and a slow cooker is super helpful. You can really quickly steam rice. You can, steam vegetables and chicken. You can really easily make chili. And there's just so many very simple, naturally gluten-free things that you could make using it that don't take a lot of time or expensive ingredients.
Great, thank you. And Vanessa, I might ask you to share the book name again for the post-event email. There was another question in here asking if Schär charges a fee for training colleges. No, I will do that for free if your college needs help. I'm happy to help in any way. That's absolutely something I can do to help the community. Okay, I don't see any other questions in here. So following this event, you will be getting a lengthy email with a lot of resources from all of us. And please feel free to share that information with other people who are going through this, people who couldn't make it tonight that you think would benefit from this information. I think we've emphasized a lot that we are all here to help, but we also know a lot of people who can also help you in various areas of the country. So don't hesitate to reach out to any of us, Beyond Celiac, myself, Dr. Burma, or Vanessa at Boston Children's. We can all help you, and we will do our best to get you the help that you need. So I hope you found this helpful. Thank you so much for joining, and we'll hopefully get to be in touch with a lot of you in the future.